welcome to another edition on Oranges. I am Aisusa Monilari, and like we always say, health is a fundamental aspect of the human life. And when you're healthy, you can function properly in your environment, in your society, and even in your workplace. Yes, so today on Oranges, we're going to be talking about the informal sector. But I have with me pharmacist AB of Inyesika, who is the head network management of Ondo State Contributory Health Commission, who is going to help us do justice to the topic of today. Good day, it's nice to have you on the show.
Good day, madam. It's always a pleasure.
Okay, we're talking about the informal sector. So do you mind telling us what the Orange informal health sector is all about, and who are the category of people that fall under this the scheme?
Thank you very much. Oranges has two layers: the Oranges formal, Oranges informal sector. The informal sector takes care of 90% of the population and residents of Ondo State. The informal sector covers for the Okada riders, the market women, organized private sector, artisan, every artisan in the state, people that are getting their daily income, daily wages. Everybody is covered under the informal sector. And for anyone that is not working with government, belongs to the informal sector.
Okay, in essence, for people who do not get, they don't get their monthly payment from the government, falls under the informal sector. Okay.
And the essence of this is to see that people do not suffer financial hardship because they want to access healthcare, and that's what Ondo State government has done. And this has impacted in the life. When you were giving your introduction, you said health is very fundamental in a human life.
Yes.
See, if you are healthy, you are productive. So the essence of government is that there should be a population of healthy and productive residents in Ondo State, and that's why government is doing what government is doing. With a token contribution, you have array of healthcare services without paying a dime.
Okay, so now talking about the without paying a dime, that brings us to the plan type of the informal sector. So what are those plan types?
So we have one for the Oranges informal sector. We have an individual plan. The individual plan is for those below 60 years, and we also have an individual plan for those above 60 years. It's understandable. For those that are above 60 years, we know their conditions, so that's why the price varies. So for individual that is below 60 years, 18,000 naira for a policy year, just 18,000 naira. I tell you, I saw a friend yesterday, and he said, look, I had malaria, I've spent more than 15,000 on one malaria treatment.
Yes,
he has spent more than 15,000. But with the informal sector, just pay 18,000 for that year,
a policy year.
For a policy year. If it starts today, which is today is October,
yes,
it will end in September next year. I think I'm correct. So that's the way it works. Then for those that are above 60 years, it's 36,000 naira for the policy year. Then there is also a family plan. A family of the husband or wife, spouse, and 4 biological children below 18 years.
Okay.
90,000 naira.
For a policy year.
For a policy year.
So for the 18,000 naira for individual plan, so that means even if the person falls sick 2 to 3 times before the end of that year, it's a one-time payment. You don't get to pay again
at all.
So it's just like more of a free visit. Whenever you go to visit the facilities, you don't need to pay a dime, even if you get to treat malaria 2 or 3 times.
Even if you get to do surgery, you don't need to pay. You know why? The insurance business is that everybody is contributing something into a pool. I am contributing, you are contributing, every resident is contributing. So in that pool, we expect that all of us will not be sick at the same time. So when one of us that are
Fall
contributed
sick.
in that pool falls sick, needs care, we pick from that pool and pay to the hospital where you access care. So it is hand joining hands. Nobody should suffer because I want to do a particular surgery.
Yes.
Because this surgery is covered under the Oranghis informal sector. It's covered under Oranghis because whether it's formal or informal,
the
the
informal
benefit
sector
package
It's
is
the same.
The benefit package is the same.
Okay.
It covers malaria treatment, typhoid, hypertension, diabetes, surgeries like appendectomy, ionography, CS, delivery. All are covered under Oranghis.
But the plan varies.
Yes, the only top up one needs to do if you are buying a 18,000 naira plan, you don't have access to antenatal and delivery services.
Okay.
That means you have to buy, if you are a woman of reproductive age and you want to buy the informal sector plan, you need to buy the family plan because that's what covers you. Except
And
that
the family plan is for what's the how much?
it's 90,000 naira only.
And what does it cover? Who does it cover?
It covers the man or the wife, the spouse, and 4 biological children under 18 years.
Under 18 years.
Yes, we say under 18 years because we expect that at age 18, after 18, we expect that the children will have gone to higher institutions.
Okay.
And the Ondo State Contributory Health Scheme has another plan for children who might have left their parents' home and have gone to school. So what we call T-ship.
Okay.
There is a T-ship program, so they are not under you, they are just at that moment, they are in tertiary institutions. So there is a program for tertiary institutions health insurance program.
Okay.
So that one covers for those cohorts of
those
people
that are above 18, these
so
students.
That's why the family plan is reaching us to 18 years below for the family plan. So if, for instance, at the time you are buying, you only have a child, or at the time you are buying, you are expecting that you will get pregnant, you are not expected to top up again. The moment you buy the 90,000,
yes,
it takes care of when if you in the process of that policy year, if you deliver, it is just to bring the birth certificate, the name, the birth certificate, and the passport. We will enroll him under you. It's your dependent. You are not paying additional.
So you don't have to pay an additional money for the child again. Once you enroll, if during the course of that 1 year, the mother gives birth, automatically the child is covered.
The child is covered.
Okay.
So because you are buying a family plan, and you know the beauty of it, I must say you are a woman. Today, average CS is 250,000 or 300,000. So you might be wondering why ODCAC will say the informal, the family plan is 90,000.
And the 90,000 is not just for the mother alone. It covers the mother, the father, and 4 biological children.
Below 18 years. So it tells you that it is not what you are contributing. It is the contribution of all to treat one. Because not all of us will do CS at the end of the day.
Yes.
Not all of us.
Yes.
So, but we need to have this financial backup. Backup somewhere, so that when you have a medical emergency, you go to just your hospital, your preferred hospital that you have chosen from our area of accredited facilities, and go there and get care. If you get there and the service is not available, there are layers of referrals. You can be referred from the primary to the secondary to the tertiary.
You spoke about facilities. You said they get to pick from the list of accredited facilities. So that means the institution don't choose facilities for the patients.
Not at all. It is the patient's prerogative, patient's right. When you look at our operational guideline, rights and privilege, rights are spelled out. So there is a right for enrollees, and one of the fundamental rights of the enrollees, once you pick, is you have the ability to pick your preferred hospital from
the list of accredited facilities.
And the providers are the ones that we all know that have met the standard of the State Ministry of Health and the National Health Insurance Authority. So it is not, they are not just hospitals that are not up to standard. These are people that have gone through this training from the State Ministry of Health. So first, for a hospital to be qualified, it has to be registered and approved by the State Ministry of Health.
Okay.
Then it has to get accreditation from the National Health Insurance Authority. With those two, then we will now on board.
That brings us to quality assurance. How often is quality assurance done on these facilities?
Beautiful. To maintain standards, it's not easy.
It's not easy.
So we have to always be on the hospitals to ensure that the standard of care is at par with international standard and best practices. So, as we speak now, our officers are on the field for the third quarter quality assurance. So we do quality assurance every quarter.
Okay.
We have done in first quarter of this year. That was so to look at, to ensure that we'll be able to cover, because resources are limited.
Yes.
And also personnel are limited. We decentralized and see that in the first quarter we do in the south, Southern Senatorial District. That is the Ilaje, Eseodo, Kitipokpa, Otigbo local governments. Then in the second quarter we conducted QA, quality assurance and improvement, in the Northern Senatorial Districts, the Akoko Northeast, Akoko Southwest, the Owo and Ose, all the Akokos. That's what we did. So right now we are in Akure North, Akure South, Ifedore, Idore, Ondo West, Ondo East.
Okay.
To ensure that they still have and they are still maintaining
the standard at which you accredited them on before.
Yes, personnel, infrastructure, the terms of quality of service, who are coming. You have 2,000 enrollees. How many of them are coming? What are the feedback? So one unique thing we also did was that when we get to the facility, definitely we also want to see if there are our enrollees are in the facilities.
They coming?
So there's one list we call exit questionnaire, which is for enrollees, and the hospital does not know about it.
Okay.
So we just visit the enrollee to tell us the experience. A few questions. What is your waiting period? How long did you wait to see the doctor? How long did you wait to get your drugs? Were all your drugs given
to you? Were you attended to properly?
Exactly.
I think this brings us to the next question, which is case management, because I think this is where the issues come from.
So health insurance is about sustainable financial health care delivery.
Okay.
So in most facilities today, facilities where we have meetings, they will say, oh, if not for Oranghis today, we wouldn't have been able to do this. How many people today have the money to go to the hospital and pay out of pocket? No. Now people are depending on health insurance. A provider told me, I said, guy, if not for this program right now, if not for Oranghis, we might have a lot of casualties. People will not be able on their own afford to buy their medications. Those that are hypertensive.
Yes.
Monthly, there are people that will pay as much as 20,000
on the drugs.
And there are drugs that you must take every month. So we call them drug refilling, and they must go to the facilities and get these drugs. Imagine they were not paying. So the hospitals now understand that Oranghis is what is sustaining them right now, most of the hospitals. Because with insurance, whether they come or not, there is one we call our payment mechanism. There is capitation.
Okay.
Capitation is that whether they come or not, we pay the hospitals. It's for basic primary services anyway.
Yes.
But
side in Akure, where the children and the spouse are not in Akure, let's say they're in Ondo City. So how can they come in now?
Yes, it's very easy. One of the key components of universal health coverage is access to care.
Okay.
So it is better. I am staying in Akure. My facility should even be very close to me.
Okay.
So that you don't even pay
extra for transportation
to access care. So what we do is that if you are resident in Akure and your family is in Akoko, let them pick a facility, because we're everywhere. We have
so
a
they can pick a
facility
facility
everywhere.
at their location.
Where you are resident.
Okay.
So the husband does not have to go back there to access care.
And the wife doesn't have to come to the
Accra
husband to access care.
So where you are, you can enroll you here, and your dependents where they are resident. We also have a facility.
And then
there
they pick
where
a facility there.
You don't have to compulsorily be in the same facility, especially the fact that you're not resident in the same location.
Okay, still on facility, is it easy to change facility in terms of proximity? Just like I said, now let's say the husband now moved to where the wife and the children is residing.
Yeah.
Can he change his facility?
Yes, for ease of operations.
Okay.
For ease of operations, you know, we have processes. For instance, we draw capitation on the 15th of every month.
Okay.
So for ease of operation, if you miss this deadline, it will be difficult to trace your transfer or your change of facility.
Okay.
But in every we made it easier that in a policy year you can only change once in a month.
Once in a policy year.
Once in a policy year.
Okay.
Yeah, once in a policy year. Once in a year. So you can only change one. But there are exceptions. Exceptions like relocation.
Okay.
For instance, for civil servants, they can be transferred at any time.
Hmm.
But for informal sector, if you have moved or God has blessed you because you are not spending money on healthcare again, you have made savings. You have made savings, so you are not spending money on healthcare. At the end of the day, you now have built your own property. And you want to move. Yes, you can change immediately.
Okay.
There are exceptions, transfers, relocation.
But normally it's supposed to be once in a policy year. Okay, how often is medical outreach and sensitization done?
Yes, beautiful, because you know today now in Ondo State, there is one visible agency, visible. Anywhere you go, there is Oranghis. There is Oranghis. So we do sensitization and outreaches whenever there is a government function.
Okay.
We go there to ensure that, you know, we are helping them. If you check and there is a problem, for instance, we check BP and the person does not know, because that's one of those diseases they call silent
killers. Yes.
It doesn't talk. It doesn't tell you that I am high, you are normal, you are going to work.
And then I think that's why we see lots of cases where people just collapse. Yes.
So when we check and discover that it's high, intervention is immediate. It's swift. We take you immediately to our hospital, accredited hospital, and they take care of you. We pay. Simple. And then we also have what we call third-party administrators. Like I mentioned earlier, there are people, we do not have the human resources like we want it to.
Yes.
So we have a third-party administrator who is like a gap between the commission and the enrollees and the providers as well. So they also do monthly sensitization. They go to schools, they go to matches we are doing here today.
Okay. All right, thank you. Is health insurance only for the sick?
If it were for the sick alone, it will not be cross. Let me give you this. Your car that you are insured, was it faulty before you insured it? No. It is important we insure our health before we fall sick. For instance, I am now, as I am, since we have been doing this, I've not had any cost to go to the hospital to access care, but I am insured for any medical emergency. Not that when there is an emergency, we'll now start
running around.
We will now contribute, please, we need to help. So if we are going to do that contribution for one of us who has medical emergency, tomorrow another person falls, how long are we going to do this contribution? But health insurance is for us that are healthy. If it's for the sick, we call it in insurance adverse selection, because you already have a case.
Okay.
That is why because you cannot afford it, that's why you are coming to buy
insurance plan.
So health insurance is for the healthy,
everybody,
for every population.
Okay.
The essence is to see that we don't suffer at all.
Okay. Another question that needs clarification is this: the Orange Health Insurance Scheme, is it for indigenes of Ondo State alone?
God. Government of Ondo State is a very responsive and very responsible government. As far as you are resident in Ondo State.
Emphasis.
Resident.
Okay, so you don't have to be an indigene. No. You just need to be a resident. As long as, and I think when we talk about resident, we mean people living. As long as you are living in Ondo State, you can go for the Orange Health Insurance Scheme. Okay, so now for those who are interested in registering to be a part of this scheme, how can they come in? How do they register?
Yes, quickly, you can just visit us at our office at Alagbaka, Ondo State Contributory Health Commission, ground floor, Ministry of Health. It is the office before Governor's office. Ground floor, the place is painted blue and white, Ondo State Contributory Health Commission, where our dedicated staff will be there to see you and attend to you. Get a form. The moment you fill your form and you submit, we'll give you a starter pack with your ID card and the frequently asked questions, where you'll be able to understand the plans. Questions that were not clear to you, we give you a pack that contains answers to all of them.
You also get to know your rights and the healthcare services that you are entitled to.
Again, that even when you visit the facility, Rome was not built in a day. Yes. Health insurance is new. There are still some sketches of cases where you go to the hospital and you are told to pay.
Okay.
Where we also tell you that no, before you are told to pay, please call. There are numbers that you need to call.
Okay, helplines.
Yes, helplines, 24 hours helplines that you are not expected to pay.
Okay.
For any emphasis on any covered service.
All right, thank you very much. What are your parting words you would like to share to the people out there?
In today's world, please, Ondo State government, led by His Excellency Dr. Lucky Oranghis has given us a very good opportunity to say, please do not suffer financial hardship because you want to access healthcare. There is a plan for everybody. Please get insured today.
Okay, just like he said, please get insured today. When you are healthy, you are productive, and when you are productive, even your impact will be felt in your society and your workplace at large. Until next week when we come your way again, this is Oranghis and I am Isusa Munilari. It's bye for now.